So now it's time to launch session 1, and our theme for this session is defining the One Health state of affairs. And I'm pleased to introduce Dr. Kent Kester, who's the Vice President and Head of Translational Science and Biomarkers at Sanofi Pasteur, who's going to moderate session 1. Over to you, Dr. Kester.
Thanks, Casey, and thanks, Dr. Goosby, also for a great kickoff keynote. So this session tries to set the stage through a number of case studies, 3 case studies, where we'll look at a number of One Health practices, how they've been integrated into public health systems, some relevant barriers, and strategies that can be used to mitigate some of these barriers. I think these, anytime one is trying to solve a big problem or promote improvements, case studies are really powerful tools to understand what the real challenges and opportunities are and how they've been surmounted, hopefully. So we have 3 speakers, we'll go through a number of aspects at local level, country level, and beyond. And really to give a flavor of really some of the real life challenges that have actually occurred thus far, and I think will be useful food for thought as this whole workshop continues. So let's start. So at the end of this, we'll also have a Q&A session that'll go for about 30 to 45 minutes, depending on the volume of questions. And we'll have opportunities, of course, to ask our various speakers on different topics that they've presented. So our first speaker is Dr. Dana Backham, who comes to us from the Harris County Public Health in Texas. And she's going to talk about operationalizing One Health at the local level. So Dana, if you can activate you're on. Okay, take it away.
Well, good morning. And thank you, Kent, for introducing me. Thank you to the forum for inviting me to talk about operationalizing One Health at a local level. As Kent said, my name is Dana Wilkes Backham. I'm the director for the Office of Science, Surveillance, and Technology with Harris County Public Health. Next slide, please. I want to give you a little bit background before I really dive into details of how we operationalize One Health here at Harris County Public Health. Background about the county. Harris County is located in the southeast part of Texas, right by the Gulf of Mexico. We have a population of nearly 5 million people, and we span over 1,700 square miles. That makes us really big, diverse, and very complicated and complex. Next, please. As I said, that we're very diverse. We have over 145 languages that's spoken here in Harris County. We are home to the 4th largest city in the nation, which is Houston. And Houston has actually 2 large health departments, Houston Health Department and Harris County Public Health. We are home, Houston is a home to Texas Medical Center, which is the largest medical center in the world, as well as having one of the largest ports, 2 international airports, very large petrochemical chemical plant facilities throughout the county and neighboring counties. And Harris County Public Health is home to the largest refugee screening program in Texas. That really does make us very, very diverse. Next, please. A little background of how Harris County Public Health is made up. We have 5 offices and 5 divisions. The offices give the breadth, and they are cross-cutting across the department. So we have the Public Information Office, which includes communication, education, and engagement. Of course, we can't do anything without the finances and the
Dana, thanks.
Yeah. Can you hear me now? Okay, thank you. With Harris County Public Health, we have 5 offices and divisions.
Dana, you're muted again.
It appears that I'm having technical difficulties, so I will continue on. 5 offices, 5 divisions. The divisions are specific in a subject matter. For instance, we have the clinics, disease control that includes TB and refugee program, environmental for our sanitation and inspections of the environment around us, mosquito vector control, we have nutrition and chronic disease, and veterinary public health. As far as the offices, policy and planning, preparedness, and surveillance and EPI. Next, please. I went over the offices and the divisions. That makes us a full service, a comprehensive local health department that extends from veterinary public services, animal control, to preparedness, to dental, as I mentioned, HIV prevention, outreach, mosquito vector control, and of course, inspection of pools and nuisance complaints, as well as sanitarians and immunizations. Next, please. So I mentioned a little bit about Harris County, and because we are on the Gulf of Mexico, we are the gateway of hurricanes. So we've experienced quite a few hurricanes. And I mentioned also that we have one of the largest petrochemical facilities that's in the nation. And because of those things and many other things, we have a lot of incidents and events that occur. Here's a list that extend from 2001 all the way to present time now. If you look on the right column, the last 4 bullets, Hurricane Harvey, we're still responding, and that started in 2017. We had a petrochemical fire in 2019, and of course we're responding to COVID-19, and we just, we're still responding to the winter storm Uri here in Houston and in Texas. The next slide will show the offices and divisions that make up the One Health team at Harris County Public Health. Science, surveillance, and technology, dealing with epidemiology, tracking and monitoring, also dealing with housing data, and being a repository for science-related items. Then there's the physicians with the clinical disease control and clinical prevention. Of course, veterinary public health with animal control and the health and safety codes relating to rabies. Mosquito and vector control division, nutrition and chronic disease that can consist of our mental health area, and environmental public health with not only making sure that our food that we're consuming is safe, but it also houses lead prevention, as well as our built environment. Next, please. So this is making a case for One Health here at Harris County Public Health. We've been talking about this since 2013, and it became really operationalized starting in 2014. There are plenty of, as Dr. Gooseby had mentioned about infectious diseases that are going on, plenty of zoonotic diseases. Over 60% of infectious diseases result from animals. So before One Health, we worked in silos, and it's very easy for us to work in silos. So let's use the example of West Nile virus. So if the epidemiology department, surveillance and epi unit received a positive lab result, they're going to do what they do and confirm that if this is a true positive confirmed case. And then they would work it, investigate it, educate the person, contact the hospital, do all of those processes in EPI, and report it to the state health department, in turn report it to the federal health department. Mosquito vector control, they would test their mosquitoes for West Nile virus, and then they'd go spray. And then there are people, our animal control officers, as well as our sanitarians that are out on nuisance complaints, would travel the 1,700 square miles of Harris County and see old tires there. And we know that old tires are breeding ground for mosquitoes. So once we implemented the One Health program initiative here, that's when we really had some collaboration. We're breaking down those silos. And so the surveillance and epi unit would actually notify the mosquito vector control. We have a positive West Nile virus case in this zip code, and we had to share data. So that's one of the barriers that we often, not only Harris County Public Health, but different levels, local, state, and federal levels have is sharing data. So we learned, we secured a process to share the data of where the positive case is, so mosquito control can go out and do their next steps or make a decision if they needed to spray or not. Animal control officers and sanitarians that are out and about that actually see tires, they will report it to mosquito vector control. We would report it to the entity that would remove those tires or get mosquito dunks and just dump them in that area to prevent the breeding of the mosquitoes. Next, please. Another example.
You're muted again.
Yeah, thank you. Another example of Harris County Public Health.
And again.
Is with our our Zika response. With that, we created a multidisciplinary team that consists of law enforcement, policy staff, veterinary public health, epidemiology, environmental public health, and of course, people from the medical profession. So this team trained together, worked together, including our communication and education and outreach team would train together, and we would go out into neighborhoods, educating the neighborhoods on how mosquitoes are bred. Here are some of the things that we do. Actually testing mosquitoes for the Zika virus. And we actually looked in the areas where there were a very high social vulnerable index. We looked in the areas where when something happened, an incident happened, it was really hard for them to bounce back, looking at how resilient they were. So we wanted equity. We looked at this and we responded with an equity lens. Next, please. With the Zika response, it was going from low tech to high tech. So low tech, boots on the ground, doing outreach, educating people, having health fairs, partnering up with home associations, with churches, and et cetera, to high tech, such as partnering with our Microsoft on a system that actually captures mosquitoes and counts the number of flaps that the wings move, count the movement of the wings to determine what their species, because different species carry different viruses, and determine the sex. So this is just one example of, Harris County Public Health implementing One Health. Next. Rabies here, rabies it's been around for a long time, and we've done a really good job. When I say we, the nation's done a really good job of decreasing rabies over many, many years. But here at Harris County Public Health, the majority of the rabies that we have are in bats. So each year, the bat rabies is about 7 to 10% of what is submitted for testing. And when there is a rabid animal, there is a system that is triggered, and everyone that's on that system, it's a multidisciplinary team, will be aware that there is a rabid bat that's in this neighborhood. Animal control officers will go and do outreach. Our physicians will be communicating with the veterinarians, ensuring that anybody that was in contact with the rabid bat was evaluated. And if rabies post-exposure is needed, then the physician, the human side, would assist in getting rabies post-exposure. Being once upon a time a zoonosis control veterinarian, this is something that I did often, and it was a really big challenge of people evaluating people that have been exposed to rabies, whether it was warranted or not. So as you can see, we have media that's involved. We do community outreach. We work with wildlife rehabbers on rabies. So this is our approach that we use for having rabies and no.
You're muted again.
Next, please. This is one of the most
Muted. Still muted.
Harris County Public Health puts on a One Health conference each year. It has evolved. It's been going on for the past 14 years. It has evolved with from a veterinary workshop at our local zoo to a veterinary conference. And in the past 4 years, we've renamed it to a One Health conference. And this past year, we had it in October. Of course, with the pandemic, it was a virtual conference. And we got great feedback because we were able to get really very, very phenomenal speakers to come and speak about things from One Health to the emerging pathogens to the explosives dealing with One Health, microbial threats. So it consists of everything because we're trying to actually pull those different disciplines together so we can have a really good discussion. This year, it will also be in virtual as well because of the pandemic. Next, please. With Hurricane Harvey, so this, I said this occurred in 2017 and we are still planning, we're still responding, trying to recover from Hurricane Harvey. We use a multi-agency coordination. We communicated, we collaborated, and we coordinated with different agencies throughout the county and in the nation. Did a lot of community engagement. Harris County Public Health has a mobile health village, and we take public health to the public. So it's really a one-stop shop that you can get your animal, take your animal, get your dog vaccinated for rabies and microchipped, take your child to get dental evaluation. You can get the flu shot, information on preparedness. You can register for WIC food benefits, et cetera. So we carried out those mobile health villages with Hurricane Harvey throughout the county. We also conducted shelter surveillance, and the shelters were, there's a picture at the lower bottom of the slide of a man sleeping on a cot with his dog. So we had plenty of shelters for people and shelters for animals as well. Next, please. Talking about COVID-19 and One Health. So we have been responding to COVID-19 since January 9th of 2020. So it's been over a year, and we've tweaked the process during that time. As far as the surveillance and epi units went from 25 staff members to nearly 500. And we have included social services, that if someone was quarantined and are isolated, did they have a place to be quarantined and isolated? We educate the pet owners that people that need to isolate and quarantine, giving them information about that. Testing and vaccination, making sure that they were not in, again, using an equity lens, that they were not in the area of having testing deserts or vaccination deserts. We used our Office of Policy and Planning to help with policies and guidance for COVID. And of course, media, social media, news releases. We have the Health Alert Network for dental, veterinary, and for the healthcare, sending out information that is needed. There is a seroprevalence project looking at the prevalence, the seroprevalence of people that actually had antibodies against COVID-19, as well as a project with animals looking at seroprevalence and prevalence. And of course, learning from lessons learned from China and South Korea, those entities, countries are sharing their best practices with us. Next, please. I mentioned that we are just responding. We're now responding and recovering from Winter Storm Uri, which severely impacted the Texas area. I can speak about Houston in Harris County. So there was the surveillance and epi unit had to monitor warming centers, and we could not forget about the homeless population, mental health. We couldn't forget about the animals. So those were some of the things that we were dealing with besides carbon monoxide poisoning. Next, please. I have one more slide. I just want to end by saying that we are implementing different types of initiatives for One Health here at this local level. We started from having no person to finding funding for 2 years to get someone to help us coordinate a One Health response and initiative, to now having a full-time equivalent position, a One Health coordinator, as well as a global health coordinator. So we are starting. We're not, this is just the tip of the iceberg of what we're doing. There will be more emerging pathogens, more different coronaviruses that are going to pop up in the next few years, more cases, more infections, more germs, and more risk. And what Dr. Gooseby had mentioned, we do need to coordinate better. We need more funding and more research and education. The last slide, please. So how do we do that? We're doing that by advocating for One Health. We're looking at policies and fundings to support our efforts at the local level. And we had to really educate our governing body on One Health and the importance of One Health, what it is. So there are some things that we can improve on, such as looking at the basically evaluating our response and identifying those gaps so we can improve them and continue to have that conversations with the multidisciplinary areas. So that is it for right now. And again, thank you for allowing me to share what Harris County Public Health does on a local level for One Health.
Okay, thanks, Dr. Backham. A very nice presentation, and we'll come back to you in the questions.